Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. Prime Minister Narendra Modi announces that centre will provide free vaccines to states for all people above 18 years starting 21st of June. Ruling BTA government says financial management on COVID-19 pandemic done in transparent manner. Health Minister Bangyapom meets with officials of District Hospital Dimapur, reviews on availability of medical equipments and other logistics. And Nagaland Health Department to conduct intensified COVID vaccination drive from tomorrow. In the wake of COVID-19, we appeal to our listeners not to lower the guard and stay safe and protected by following these 4 simple steps. Wear a face mask, maintain 6 feet for social distancing, focus on hand and face hygiene, and get vaccinated. For providing COVID-related information and guidance to the people, national helpline numbers 011-2397-8046 and 1075 and state helpline numbers 700-553-9653 and 1800-345-0019 are operational. Now the news in detail. Prime Minister Narendra Modi today announced that the Government of India will provide free vaccines to states for all people above 18 years starting 21st June. Addressing the nation this evening, Modi said no state government of the country will have to spend anything on the vaccine and the Government of India will provide free vaccines to all the countrymen. He said that the government has decided that 25% of the vaccine responsibilities that were looked after by the state governments will now be looked after by the centre. The Prime Minister informed that Pradhan Mantri Garib Kalyan Anna Yojana has been extended till Diwali. Responding to the allegation of opposition party on financial mismanagement of funds in the time of COVID pandemic, the BTA government has said that the government has been performing on a war footing against the pandemic in a transparent manner. In a press release issued by BTA Media Cell today, it said financial management and usage and public funds are available on the websites of the concerned departments, and there are also democratic avenues through platforms like RTI. The BTA Media Cell stated that it is the government's bounden duty to make its performance and duties transparently known to the people, but also the responsibility of those questioning to ensure that allegations are substantiated and based on facts. It said statements should not be made just for the sake of criticism or for creation of sensationalism, especially at a time like now when all need to unite as one to overcome the challenges that we face every hour. The BTA stated that constructive suggestions and highlighting of the challenges by the opposition is well appreciated, and the concerned government departments are seriously following up on the matters that have been flagged. However, the situation demands that responsible parties and senior leaders should conduct themselves accordingly if they are to gain the respect of the masses. Nagaland Health and Family Welfare Minister Bangyapom today held a brief meeting with the medical officers of District Hospital Dimapur. During the meeting, the Health Minister took note of the grievances and also reviewed the availability of equipments, medicines and other logistics. After a patient hearing, Bangyo assured all possible help from the department according to need-based system. He pointed out that every department has a system which cannot be bypassed and advised the officials to send the requirements in the form of proposals. Expressing concern on the lack of CT scan and X-ray machines at District Hospital, the Minister directed the Chief Medical Officer and Medical Superintendent for submitting the proposal at the earliest so that the department can provide the necessary requirements. Highlighting on the COVID scenario of Dimapur District, Medical Officer Dimapur, Dr. I. Moa Demchen, informed that there are presently 10 COVID hospitals, of which 2 are yet to be activated. The CMO further informed the Minister that sufficient COVID beds and oxygen cylinders are available for the district. While Medical Superintendent Dimapur, Dr. Kriles Sanyo Mehta, apprised the Minister that 50 bedded equipment was donated by Round Table India Trust in collaboration with Rotary Club Dimapur at the designated ward in District Hospital Dimapur for which the equipments have started arriving. The medical superintendent also requested the minister to look into the matter for rational distribution of manpower. Nagaland Health Department will be conducting an intensified COVID vaccination drive from tomorrow till 18th of June. Principal Director of Health Department, Dr. Kohima said all health facilities and outreach session sites in urban colonies and villages will be covered from Monday to Friday. Dr. Kohima said all eligible beneficiaries of 18 to 44 years and 45 years and above can avail the opportunity to get vaccinated with Covishield vaccine. He further said one may contact their village or panchayat chairman or medical officer in charge or ANMN, Asha and Anganwadi as to when the session will be conducted in their village or colony. Dr. Kohima also informed that other than those COVID vaccination centres shared by the district officials for online registration and booking, all other sessions will be on-site registration and vaccination. The Principal Director further said special priority will be given to persons with disabilities for vaccination and therefore requested them to contact health workers in their respective areas. Dr. Kohima also advised all beneficiaries to maintain COVID-appropriate behavior at the vaccination sites. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on a YouTube channel, AIR News Kohima. Deputy Chief Minister Y. Patan today met with Dimapur Press Club at his residence in Dimapur. During the interaction, the Deputy Chief Minister acknowledged the human services rendered by the media fraternity in disseminating right and timely information relating to COVID-19. As a token of appreciation and to encourage them, Patan donated N95 face masks, gloves, sanitizers, and financial assistance in the presence of DPRO Dimapur. Speaking on behalf of the media fraternity Dimapur, President Dimapur Press Club, Philip thanked the Deputy Chief Minister for showing his concern towards the media persons and assured that the press fraternity would continue to disseminate factual and important information for the welfare of the people. Minister for Public Health Engineering Department, Jacob Zumami, today donated 2 units of high-frequency X-ray machines to District Hospital Dimapur, the COVID-designated hospital. The minister handed the machines in the presence of Deputy Commissioner and Chief Medical Officer Dimapur. Minister Zumami expressed hope that the equipments will be useful for all in need, while reminding all to be alert and keep following the SOPs as well as cooperate with a medical professional. Zumami also urged all not to fall prey to fake messages which are forwarded in social media. The minister further urged all to get vaccinated so as to protect oneself from the virus. Deputy Commissioner Dimapur Rajesh Sundararajan today launched an ambulance service at Jumukedima Town Council. During the launching program, Sundararajan expressed hope that the ambulance service will go a long way in serving the people of Jumukedima area. He also reiterated that the district task force is doing its best to ensure that all citizens, not just Dimapur town, but the entire district, be it rural or urban, have access to good health care and medical facilities. The old ambulance was donated by Aldura Society to utilize during the time of pandemic. ESC and Administrator Jumukedima Town Council, Seye Kretio Solo, said minor repairs, including building a partitioning wall for driver's safety, was done with the help of 4x4 attitude, and Jumukedima Chamber of Commerce and Trade Association donated brand new tires, and the Town Baptist Church Jumukedima also generously donated towards the cause. Little Hut, a delivery service provider, have also come forward to collaborate with Jumukedima Town Council in managing the ambulance service. Nagaland today reported 145 fresh COVID-19 positive cases, taking the total confirmed caseload to 22,918. Of the cases reported, 108 new cases were from Dimapur, 16 each in Kifre and Kohima, 15 in Mukukchung, 4 each in Peren and Zonobodo, 3 in Pek, 2 in Woka, and 1 in Longlang. while 169 recoveries from the infection has added the recovered cases to 17,143, and 3 COVID deaths related also added the COVID death tally to 415. Presently, there are 4,703 active cases in the state. The Central Board of Secondary Education has extended the last date for uploading the marks of practical subjects in internal assessment of Class 12 students. The date has been extended till 28 June of this month. CBSE has also permitted the schools to conduct the practical and other assessments of students in online mode only. Controller of Examination Dr. Sanyam Bharadwaj has written a letter to the principals and heads of institutions. In the letter, Dr. Bharadwaj has said that it has been observed that some schools have not been able to complete the school-based assessments in various subjects due to COVID-19 pandemic. CBSE has asked the schools to complete the evaluation process by the 20th June. It said no extension will be given to the schools. And now, 20 News, here are the main points again. Prime Minister Narendra Modi announces that centre will provide free vaccines to states for all people above 18 years starting 21st of June. Ruling BTA government says financial management on COVID-19 pandemic done in a transparent manner. Health Minister Pangyopom meets with officials of Dimapur District Hospital, reviews on availability of medical equipments and other logistics. And Nagaland Health Department to conduct intensified COVID vaccination drive from tomorrow. That is all we have in this evening news bulletin. Good night.